So next we will have Dr. Iqbal Eliazar from Eijkman Institute in Jakarta, who will be presenting a paper titled Challenges and Realities of COVID-19 Data Quality. Pak Iqbal earned his PhD in malaria disease mapping from Oxford, and he has been focusing on biostatistics, disease surveillance, spatial epidemiology, and malaria elimination strategies in the last 17 years. And I would also like to introduce the co-authors of the paper today. We have Irma Hidayana from Lapor COVID-19, Leni Ikawati from Eijkman Institute and Oxford University, Ahmad Arif from Lapor COVID-19, and Ahmad Nur Hasim from The Conversation Indonesia. Please do have a look at the full bio in the program that accompanied this conference. So, Pak Iqbal, monggo silahkan di-share screen-nya.
Terima kasih, Bu Arin. Sudah terlihat ya, Bu Arin? Oke. Good afternoon, everyone, and thank you for the committee. Thank you for Dr. Firman and Dr. Aryan for inviting us to the great presentation today, 2021 Indonesia Update. And I would like to share some stories, experience, and also the lesson learned during the 18 months of pandemic with my colleague here. Irma is here, Leni is here, and Dr. Mas Hasib is here also from the conversations. The title of our presentation is Challenges and Reality of COVID-19 Data Quality. Okay, the structure of my presentation will cover several topics, including the wave of COVID-19 data in general, and the national visions of data and information, and when the pandemic is coming, what happened with the visions, and also where to look the quality data. And we would like to make a separation about the data needs, transparency, presentation, how the discrepancy occurs, and also the absence of the essential data. And then the last topic that I would like to share about the lesson learned and conclusion about what we had in 18 pandemics in Indonesia, especially related to the COVID-19 quality data and some acknowledgement to our collaborators. So as you are already aware that the COVID-19 interactions actually affected many multidimensional elements, start from the vulnerable population and also the transmission even and also the case finding, detection, tracing, and also affect the public performance. And it also influenced the effectiveness of the communication and also bringing up the trust in authority and questioning also the accountability of the authorities. So from the all element of the COVID interaction, it generates a lot of data actually. One of them that we would like to share here is the testing data and the date data. That is the two elements that we would like to share today. Talking about the national vision, as Pateri mentioned, actually it started in 2008, where the president of SBY released the public information transparency. Actually, it's talking about open data. It's a mandatory to public entity or the government, central or local government, to release a public information regularly. And also, they built the information committee, which aim to ensure the system works. During President Jokowi, he also released the President's Decree 2019, One Data, and they are aware that the way to integrate the planning and all execution, evaluation, and monitoring between the central and the local government, they need high quality data. And the decree also mentioned about dimension of the data quality they are searched for, the accuracy, updated, integrated, accountability, easily accessed, data sharing, and sustainability. All the mention of data quality actually is challenged and is tested during the pandemic, when the pandemic is coming. when you see that the statement of the president in the mid of March 2020, the president, the leader of government, admitted the government concealed some information about corona. At the same time, we don't want to create a sense of panic and unrest in communities. Therefore, in hiding this, we are soundless. This is a kind of contradiction when we compare with the spirit, the open data, and also the one data. One month later, the president instructed the central and also the local government to be transparent about the data COVID. And he assigns the COVID-19 task force to carry out effective, detailed, good, and transparent communication to all. And I would like to cite the strong collaboration and openness of data between all parties is needed to be able to handle the outbreak. It will be easier to find appropriate policies to handle the COVID. So that is the statement in the Compass in April 2020. But what happened in 1 year after the instruction? So we are still dealing with the reluctancy of the minister of or the government to follow the WHO guideline about the death counting. WHO recommended the probable death also counted as COVID-19 death, but the government remained at the position. The COVID-19 death must be confirmed by the positive test. So it means that the number of the death counting in Indonesia is absolutely undercounted. WHO received, MOH admit that they also received the probable death numbers from the district and the provincial level, but they keep this number. So we would like to test it about the openness, transparency, and also the one data concept during our presentation here. Actually, in the March 2020, we already recommended to the government about the openness and transparency of the data, because the data will be useful to predict, to estimate the trajectory of the pandemic. And we also mentioned about the provide the data on patient location, because this information also vital to understand the tracking system, the distribution, the spatial distribution, and also to support the tracing system. We had mentioned in March 2020. And this article, I have a personal touch with this article. This is my first contact with the Hasim One, the senior health editor in the Confederation of Indonesia, and where he guided me to write the appropriate article. So this is the personal story of this article. And 1,500 readers read this article, and it gives a significant announcement to the article as well. Something happened between March, April, and May, where the government seems to play with the numbers. So when I said the number, because they don't understand the fluctuation of the cases, it was heavily influenced by the number of testing. The number of when you had the testing increase, probably you will have the higher cases as well. But when you decrease the testing, you will have the declining of the number of positive. When you have a declining test, it isn't allowed for you to mention that the case is slowed down. So in May 2020, we reminded the government that Indonesia has not yet have the COVID epidemic. So we must to be careful to understand or to mention that the pandemic is slowed down. So we had several webinars, we read the letters, we had the article in the Confederation, how to make a epidemic curve, as well how to interpret and how to give recommendation using the data. So this is the article that we wrote in May 2020. As you can see here, the COVID-19 data flow is complex. It started from the left side. You can see that the Puskesmas, hospitals, the reference hospital, and the surveillance system at the port, at the international port mainly. So they captures the patient there, and then input the data to the big data system. They call it Neo or record. And then they share the data with the laboratory, and if they find the positive, and they notify to the local or to the district or to the provincial office that will trigger the epidemiologic investigation or the tracing or close contact monitoring. And then all information will return to the NEO record or to the other application system. And this information will be released by the spokespersons of the COVID-19. This is the examples of the epidemiological investigation or the tracing form. It's a very complex clinical information there, and also they ask about the exposure factors and the close contact listing. But at the same time, we find there is a problem because there is no incentive or literacy. It means that probably the tracer did not understand fully what the purpose of the data is collected. And we find a high proportion of the missing data in the system. It's a pity actually, because a lot of effort and a lot of people actually go to the field to collect the data, but they did not complete all the data form. So the analysis will be is not sufficient. When you see the COVID-19 go.id, this is the COVID-19 dashboard. I would say this is excellent visualization, excellent data gathering, and I thank the government to release this kind of information. When I compare to other countries, they even don't have this kind of visualization, the COVID data set. But there is some what they call it. I need to be criticized about this one, because the dashboard, they didn't have the function that allow us to extract the download data to run the analysis, to run the further analysis. And there's also a problem with the x-axis. That's why at that time they didn't utilize this information to have the epidemic curve, because the x-axis represented the date of events, case or death reported, not the date of onset, which is critical in generating the curve epidemic. The date of sample of taken is not there, and the date occurred is not there. They also relying on the date of event reported from the lower level to the central levels. And the most important thing is the testing data. I love for COVID, and I think majority of the scholars in Indonesia in the pandemic, they are very keen to look at the daily testing data, because it helps us to understand the real situation in the fields. There's no display at the daily testing data in the system. So we are not able to validate the real situation at the time. And there's a problem with the no probable death, even though the government admit that they collected the probable death in the system, but they are not released, but the government didn't release the information in their websites. Several months ago, the Ministry of Health, they release and they produce this kind of visualization information about subnational testing data, thanks to the government after several advocacy, after several pressure in the media to pursue the government to open the testing data. I think Irma from Lapor COVID would like to share his experience as well. But the problem with the data structure here is the short period of historical data, I think several months back, and there's a limited data extraction facility. If you would like to run the further analysis, you need to go to contact the ministry directly. This is, you can see the table here. This is the first hour, the first high expectation of the daily testing data. If we repeatedly mentioned to the government, also to the local, to the central government to release this kind of data. This is the number of the daily testing. As you can see from the left side, the columns, the date. This is the date of the sample taken. It also shows the number of tested people, the number of positive and positivity rate. You see from the mid-up table, it shows the current situation, but the below table shows where the Delta variant rampant in Indonesia. So you see that the proportion of positivity rate is about 2% in this month, but 30, 40% or 50% positivity rate during the in July this year. So this is the expectation of the daily tasking that we recommended to government to be transparent. It shows the real situation. There are another example of the daily testing visualization in West Java and East Java. You can see, you feel the difference, right? You feel that it's not easy to understand. It's difficult to extract. They are not allowed to. They don't give any access to extract the data. The website. The West Java and the Java is, I would say that the top 5 provinces contributed to the COVID in the country. So you will see the difference between the willingness to share and data sharing of the daily testing in these areas. And then we also at that time interested to see then how the COVID data presented. In the mid-year 2020, I think dozens of volunteers allowed for COVID visited all websites, and then they found that 447 districts had a website, whether specific or use the existing government website for the COVID data dissemination to the public. And we assess the 5 variables of criteria. You can see here the availability of local contact or data source, regular update, whether they have whether they updated the data regularly, and the ability of the website to provide us to extract the data, whether in the Excel or TSV format, historical data, or essential indicator. And we find it, the problem with the system that there is no, most of the majority of them, they don't have the functional ability to allow us to extract the data. And they also don't have the ability to historical data analysis for the trend analysis. And we look at the document and then how they present the data nationally and then subnationals. There is no standard requirement at the time for data dissemination. And also we see that most of the white start the less sense of crisis, and I would say that less data presented there, and also less data sharing practice. And when we examine the essential data indicator displayed in the website, we see that various and inconsistent presentation of the data COVID display in the public dissemination. This is one the interesting story. Pa Terry is very interested in the birth and the birth analysis. We are interested in death countings, actually. And we compare and how the provincial, we compare the discrepancy between the national and the province about the death toll. As you can see here from, let's say for example, in Central Java, the provincial websites reported about 26,000 deaths, but the Ministry of Health admitted 16,000. What are the gaps? Why we find the gaps here? When we asked the government, they mentioned that they didn't include the probable death, but actually in Central Java, they also counted the confirmed case. But I think Irma will be happy to elaborate it more. But this is the problem with the data accuracy and data quality, especially in the death counting. So we also did some project now. We're still ongoing, tracking the all-cause mortality in the 12 cities across Indonesia to look at the excess mortality as an alternative indicator of death counting. This is one of our, we call it, results publications. The most updated one will be published, I think, in several weeks to come. This is only for in 2020. You can see that, especially in Jakarta, we saw that 61% of excess burials in 2020. Where did the data come from? The data come from the burial. The data come from the health facilities, death registration, and also from the civil death registration. But the last two actually fails to detect the early pandemic because most of them.
Sorry, less than 2 minutes, ya, Pak Iqbal.
Okay, yeah, most of them are reluctant to report the civil death registration as well. And one thing is important also. There is no the data about the health worker burden, especially health mortality. Until now, we don't have any information about how many health workers have been infected. And this is one of the lab for COVID and the collaboration to release the Pusara Digital or Digital Library in September 6th. Actually, we compiled the information to calculate, to quantify how many health workers lost during the pandemic. And to the last 13 September, we recorded over 2,000 of health workers died during the pandemic. And you see that in July 21, this is the rising trend of the health worker death. And also we recorded the fatalities during the self-isolation or self-facility because at the time there is overcapacity of hospital usage in Jakarta and in several areas in Java and Bali. What the conclusion here? So there is no real-time COVID data 19, virus quality within the system, low quality in the counting and low to moderate quality in the testing and epidemiological investigation data. And I wanted to mention that obtaining and utilizing the COVID data actually demands good intention, political will, leadership, and also the actual need, scientific-driven policy. But now is the time for Indonesia to move forward in the field of health informatics. Urgent to update the national master of population data, reforming the passive death counting to active counting in the civil death regression system by using the technology. And also they need to be less bureaucratic data setting process, but ensuring the intellectual properties and mutual benefit. I think I will say thank you to my colleagues in Eggman, Oxford, and also from the Oxford Clinical Research Project in Vietnam to provide funding for this one. And also thank you for 15 to 20 journalists who involved as a fellow in Tremor Project. Thank you, the Lab for COVID, and thank you for the all volunteer in Lab for COVID. Thank you so much.
Thank you very much. Can you hear me okay?
Yeah.
Sorry, my computer just crashed, so I have to quickly switch into my iPad and I'm unable to use my Zoom background. So it's now Q&A, and please, I would invite Pak Terry to come back to the spotlight. Great, we've got some questions already, and the first question is not a live question. It's a question from Pak Inyoman Sutarsa addressed to both Pak Terry and Pak Iqbal. I'm going to read it out. Thank you for the excellent presentations. My question is both for you. Statistics are very powerful. Can you both please comment on the politics of statistics or health data in Indonesia and how these could impact the allocation of health resources? So I'm going to go, I think Lily might like to ask the question live, but before going to Lily Pramawanti, I would ask perhaps Pak Terry first to answer Sutar's question, followed by Iqbal. Thank you.
Asking me about the politics of statistics is a dangerous question. What I would say is that it is very important right now for Indonesia to step up to questions of professionalism in data. The professional associations, from my observation from far away, have not been as active as they might have been. And in this, I would include the Jaringan Epidemiologi Nasional and also the various medical professional associations. I think that BPS has been hamstrung or has been prevented from doing a better job because of the huge budget cuts. It is justifiable to move money from statistics to treatment in the middle of a pandemic, but it is questionable whether those movements should be so large as to undermine the actual treatments, because the data that have been used to guide the programs have been weakened. So I would just say that. Thank you.
Okay, berikutnya silahkan Pak Iqbal, do you have a response to that question?
Terima kasih, Pak Nyoman. So the politics of data, especially in pandemic, I think is challenging because the COVID-19 data is related to the image of the leadership. Don't forget that in December 2020, there was a local elections. So we observed that 2 months before the pandemic that the number of testing was decreasing, and the number of the number of positive cases also were concealed at the time. Because why? The central government wanted to have local elections conducted in December 2020. Our COVID was an active role with the other civil society to remind the government to be careful to run the elections, because at the time with the other expert and scholars in Indonesia, we estimated the hundred of cases will be generated during the local election. You need to remember that the preparation of the election is 3 or 4 months before December. So the COVID-19 actually is heavily affected by the image. That's what I say. And technically, I don't know about the allocation data, budget allocation to the data especially. But from our observation of the openness and transparency in the local area, especially in Jakarta and also in West Java and other areas, we don't, especially in other areas, probably in Eastern Indonesia, we don't see any much higher allocation for the data structures improvement and the others. So that's my impression. So I don't know whether probably Irma would like to step in, please.
Iya, silahkan Ibu Irma, the floor is yours. I mean, the screen is yours. Ada Ibu Irma?
Tadi ada kayaknya.
All right. Thank you very much. Sorry, I cannot put my screen on. Hope it's fine. So I think, yeah, it's a good question. Thank you so much. And thank you so much, Pak Iqbal, for the explanation. I just want to add, I would like to use the term of the statistical data on COVID-19 in Indonesia right now is actually depends on the political will. I hate to say the political will term, but as mentioned by Pak Terry and also Pak Iqbal, is actually because the government has the infrastructures, the government hold the powers of, the human resources, data and statisticians expert, along the way from the national through the very smallest level of kecamatan or puskesmas. I think I would imagine it's not too hard if the top level could, like, for example, lead the data collections, data gathering using its internal bureaucracy, and asking all levels of authorities to collect and present essential epidemiological statistic data on COVID-19 openly or transparently to the public. So I think that is the key components that unfortunately we don't currently have right now. So it's speaking about statistical data, is I think we are facing a very big challenge to push the governments to open, to be more transparent and to be more accountable in order to present the real data from the ground. I think that's from me. Thank you so much.
Thank you so much. Makasih, Ibu Irma. So next we have another round of live questions from Hatip Basri and Lily Pramawati. Mbak Lily, are you ready to ask your question?
Yes, I'm ready. Can you hear me
Silakan.
clearly?
Yeah.
Yeah, thank you, Pak Terry and then Pak Iqbal for the presentation. I just wonder, like, in order to understand, like, health profile of Indonesia, actually, we not only need to rely on survey data. It will be great if we have like a nice record on what cause of death of mortality, especially among adults, which is right now we don't have very much information about that. I just wonder, like, whether there is any information about what's government plans, or maybe is there any work that now is ongoing across ministry to strengthen the vital mortality data, especially among adults. So hopefully, like, by this data, we can further have more understanding about what's the situation of Indonesia, especially the adult health at the moment, and then how it give us like a future information about how gonna be Indonesian health in the future, especially as we will as we experience growing aging population as well. Yeah, that's all I think my questions. Thank you.
Terima kasih. Thanks, Mbak Lily. So next, Pak Hatip, are you ready?
Yes, can you hear me?
Yes, we can hear you. Yes.
Okay. Congratulations for the update. This is a layman question, forgive my ignorance. I believe that this data quality problem is not unique only for Indonesia. Yeah, maybe some other developing countries or emerging economies are also facing the similar situation. We do understand we have a problem due to the, as Terry mentioned, about the decentralization, the limitation of the budget. My question is, perhaps can you share with us, both of you, Pak Terry and Pak Iqbal, is there any sort of like country that we can benchmark with our given situation as a close comparator? And then can we learn something from their experience, how to handle this issue? Because I do believe that this is not going to be a sort of, there is no shortcut for this. Yeah, but in the short time for the very pragmatic solution, is there anything that we can learn from other country experience to solve this problem? Thank you.
Ya, silahkan Pak Terry and then Iqbal.
Thank you very much for that question, because I think we could look at benchmarking in two dimensions. One is other countries, and we do know that across Asia, there are many countries that have strengths in the collection of data, for instance, on cause of death, that are much greater than the Indonesian strengths. I would put out there Vietnam and China as being two countries where we can learn a lot. But the other dimension is history. The data on cause of death in the 1930s, collected in many kabupaten across Central Java, are much better than the data that we collect today. So we can look to Indonesia as the example to lead Indonesia. And I think that that would give us a lot of information that every public health and medical person should be studying as part of their university education. The issue of budgets, though, I think that the question of how do you manage budgets for data is a very difficult one, because if I look across the different government departments, one of the things I see is that at the director general level in ministries, there's often a lot of competition among directors general to collect data, and they are often collecting data that is inconsistent one section of the ministry with another. The One Data initiative, as Pak Iqbal set out in one of his slides, is an excellent set of principles. The problem is the implementation. And I don't know where the strength will come from to implement a much better approach across the national institutions and the local institutions, right down to the village level. Thank you.
Ya, silahkan Pak Iqbal, if you could respond briefly to that. Anything to add?
Yeah. The vital debt registration, I will answer Bu Lily first. Yeah. The vital debt registration has been tested by Litbangkes, National Health Research and Development, for I think 2 or 3 years, and it's ended in 2018 at the 100 districts. Afterward, they had no allocation to expand the vital debt registration to other provinces. So that's one thing. But we also need to understand about the data flow of the vital debt or the debt counting here, Pak Khatib Bisri. Let's say, for example, according to the law of administration of populations, Undang-Undang Administrasi Kependudukan, number 20 in year 2018, if I'm not mistaken. The system of the debt counting is a passive. If you have a family members deceased, dead, and it's required for the Ketua RT to report it, the family, to report the event to the local civil debt registration. It means that if the family or the Ketua RT did not report it to the civil debt registration, we will miss the data. There are some studies by the Litbangkes show that actually the passive counting system missed 20 to 60% of the actual mortality. So, if we receive the report of death, the death counting, whether in BPS or in other ministry, we need to think about, this will be the under count is 20 to 60%, because the system is passive. That's why in my presentation I learned from the COVID-19 pandemic, the system must be changed to the active. The civil in the Ministry of Internal Affairs, as Pak Terry mentioned, there is a directorate specific for register birth and death as well, and any other events. Birth and death is a very important event in the population health system. And this director of general to be more active to collect the data from the Ketua RT, because the Ketua RT, according to our observation and in several areas in Java, they have a very good system to record the number of their members who died during the pandemic. But because the system is a passive, of course we will miss the data. So the investment to be change the system, change the regulation first to be the active. I don't know whether the Australia or the other countries they have a passive and active system, but this will see the flow in the current debt registration in Indonesia. So that's my comment.
Thank you, Pak. We don't have Pak RT or Ibu RT where I live here. So, so the organizer has given me the permission to go 2 minutes over time. And what I'll do is I'm going to ask Ibu Ann Booth to ask her question. She has a specific question to Pak Terry. And for the other panelists, if you don't mind, there are lots of questions that you could also type the answer if you like later after the session for the other questions listed in the Q&A. So silakan Ibu Ann, ada last question for Pak Terry.
Can you hear me?
Yes, we can hear you nice and clear.
Fine. Well, thank you very much for these very, very interesting presentations. I'd like to ask Pak Terry about the role of the BKKBN in the stunting program. Why were they given responsibility? And to what extent is it interfering with what one might think of their traditional role, which of course is providing family planning facilities? You may know there's a program here in London, Action Against Stunting, which has been presenting quite a lot of data on Indonesia. But I was a little surprised at their assertion that the BKKBN has apparently now a primary role in this. And I wondered if you'd explain why.
Thank you very much, Bu Ann Booth. So Pak Terry, 30 detik. Terima kasih.
BKKBN and the Ministry of Health have been in competition for the family planning activities of the country for almost 50 years. And the BKKBN over the years has always moved into other areas to expand their mission and vision. If you go to their website, they have a lot of information as to why they feel themselves to be strong on dealing with stunting. And it has to do with the original activities that they carried out in the post-Yandu era, where the BKKBN officials with health officials would work to improve nutrition. I am totally skeptical of any value coming out of this.
Wah, terima kasih. Perfect 30 seconds. I'm afraid we have run out of time. I do see some questions that haven't been answered from Pak Wahyu Susilo, from Lila, and from Syafiq Asegaf and Riana. So maybe Pak Iqbal or Pak Terry, you're welcome to answer, type your answer. I'm going to now pass over to Associate Professor Sharon Graham Davis, who will be chairing the next session. Terima kasih semuanya.
Terima kasih Aryan. Selamat siang, selamat sore teman-teman.
Thank you Pak Terry, Pak Iqbal.